Hello again. I hate to interrupt your lunching, but we wanted to go ahead and get started with our afternoon program. So good afternoon. Once again, my name is Julia Neighbors, and I have the honor of presenting the Mark Chaffin Memorial Award for protecting children through research, service, and advocacy. While I did not know Mark long, I had the pleasure of working with him for a short time and came to know his wit, brilliance, and passion for keeping children safe. I was thrilled when he agreed to be the keynote speaker at our conference 2 years ago, where many of you witnessed his brilliance firsthand. This award is given in his memory of a career devoted to protecting children through research, service, and improving the child welfare system. Dr. Chaffin was a leader in the field of child maltreatment research with more than 80 peer-reviewed research articles. His main areas of research focus on child abuse and neglect and delinquency intervention and service systems, particularly the development and implementation of evidence-based prevention and treatment approaches within public sector service systems. He dedicated his career to helping at-risk children and families with a sense of fundamental ethics and the need to do the right thing. Accepting the award on behalf of Mark's family is Dr. John Lutzker.
I want to be clear that the award is for Mark. And I had asked Barbara Chaffin, his widow, if she would receive it today, and she's got something good for a change, and that is she's off either in Colorado or Missouri, I'm not sure which, for the marriage of her daughter. So otherwise she would have been here to accept it, and she sends her gratitude and regards. So I want to just say a few things about Mark, and there have been tributes literally for a year all over the country, very deserving about the scientist and human that Mark was. There are obituaries and very well-known, respected, and widely read journals. There's been tributes at different conferences. I was in August at the American Psychological Association meetings in Denver, and there were 2 tributes for Mark, which speaks to his international impact, literally. He devoted his career and his life, his adult life, to science and to prevention of child maltreatment. He was a Renaissance man. He didn't just know about science and preventing child maltreatment. He pretty much knew about everything and could articulate everything well. We brought him here from Oklahoma in 2014, and for me it was like being a kid in a candy store to have Mark 2 doors away. And he'd come pop in my office, and we'd talk about child maltreatment prevention and science, and we'd also talk about basketball, football, and whiskey, all of which he had strong opinions and informed opinions, as well as politics. He was funny. He eschewed ties. We have our center in the School of Public Health is now the Mark Chaffin Center for Healthy Development. We have a picture of him in the lobby, and he's on a boat with St. Petersburg, Russia in the background, and I was particular to find a picture without a tie because Mark really didn't wear ties. And the key thing that a colleague said of all the tributes to him, I think that sums up who Mark Chaffin was that he made everyone around him better. So Julia and Jill asked me if I felt awkward about now segueing into speaking about our keynote speaker today, David Finkelhor, and I actually don't feel awkward at all because there's so many similarities for me in getting, as I have known David now for 15 years, as about the same amount of time I knew Mark, to Mark, David and Mark. The 2 of them are 2 of the smartest people I've ever known. David eschews ties. You'll notice when he delivers his address. He has his quintessential cardigan sweater or hoodie, whatever that, I can't tell from the back, but, and no tie, a nice sport shirt. He too has international impact. He's forever traveling internationally because of his work. He is devoted to science. Mark and David have a profound sense of inquiry. David can't wait to ask you a question once he hears whatever it is you do. He's been sitting here asking questions at the table because that's what David does. He's also funny, and like Mark, he makes everybody around him better. I'm just going to really go quickly through an edited bio because you can read the bio. It comes from that in the program, but he's director of the Crimes Against Children Research Center and professor of sociology at the University of New Hampshire. His core areas have been child maltreatment and family violence. He's known for his work in child sexual abuse, among other areas, and he developed the concept of poly-victimization, which appears in a lot of his publications. Additionally, he's done extensive research on child homicide, missing and abducted children, bullying, and internet victimization. His book, Child Victimization, unifies and integrates knowledge about all the diverse areas of child victimization in the field, which he's termed developmental victimology. It received the Daniel Schneider Child Welfare Book of the Year Award in 2009. He's also written extensively about trends. Didn't I just say that? He's the editor and author of 12 books and over 200 journal articles and book chapters. He's received grants from the National Institute of Mental Health, the National Center on Child Abuse and Neglect, the U.S. Department of Justice, and several other sources. In 1994, he was given the Distinguished Child Abuse Professional Award by the American Professional Society on the Abuse of Children. In 2004, he was given the Significant Achievement Award from the Association for Treatment of Sexual Abusers. In 2005, he and his colleagues received the Child Maltreatment Article of the Year Award. 2007, he was elected a Fellow of the American Society of Criminology, and in 2014, he was awarded the National Scientific Impact Award from the Kemp Center for Prevention and Treatment of Child Abuse and Neglect. It's really my pleasure and honor to introduce my friend and colleague, David Finkelhor.
Well, thank you, Joan. That was really overwhelming. I gather that narcissism is coming back, and unfortunately, I must have missed that class in high school for some reason, because it only seemed hearing all that only seems to make me a little bit uncomfortable. It reminds me of the story about the guy who was out hiking, and he found he was being chased by a bear, and he ran, and he wasn't looking where he was going, and he came to a precipice and fell over and grabbed onto grabbed onto a root that was hanging out from the, and he noticed that, geez, can't get up there, it's about 300 feet, completely a sheer fall down below. What am I going to do? Anybody up there? And a voice booms out from the clouds saying, "Yes, my son, all will be well. You're in my hands. Just let go of the branch." Anyone else? So he's given you all this information about you to kind of lull you into believing that I'm the authority on this, but I want you to keep in mind that you have that request for some alternative opinion when I'm done. I also need to reassure you, there's a lot of concern when people see me doddering up here with I call this my Johnny Walker Red. I'm not on my way out. My contract is good for another 30 years. This is not what happens as a result of too many years of groveling for government grants. I had some back surgery, and there's, they caused some neurological damage to remove what they needed to remove, but actually I'm recovering. So actually, I spent some time hiking this summer for the first time in 6 years, and that was really very exciting. But in any case, thank you for this very nice welcome. It is great to be back here. It's great to remember Mark, who was a friend and somebody I also admired, and glad to be among people who remember him as well. I'm going to be talking today about where I think we should be headed as a field. I guess I'm getting a little impatient and sort of think we ought to get our priorities straight. But let me just start out by saying that I'm very proud and gratified to be a member of this field when I look back on what we've accomplished over the half century since this work has really started. There's just been really impressive developments in so many areas in terms of detailed epidemiology and understanding about child maltreatment and the effects that it has and its sources, comprehensive studies about its dynamics and impact. Millions of professionals who've gotten trained on these topics and are informed about it. Victims who become empowered to speak out and ushered out of silence and shadow into a world where they can really talk about these things and not just get help, but educate other people and feel validated for the courage that they have. I think we live in a world that is far less ignorant about the problem and much less likely to stigmatize and sideline the people who've been affected by it. And we should all feel really very good about those accomplishments. But we acknowledge that the problem is still a massive one. We feel like we're lacking those magic words that could get our societies just fully motivated and committed to eliminating this problem. And I do think that people who were involved in inaugurating the concern about this problem 50 or 60 years ago probably would be surprised that it has taken so long, that it's turned out to be more elusive than we originally thought. So we're engaged, I think, in a conversation about where we should go, and I want to weigh in on what I see where the priority should be. And here's what I'm saying we should really put our money and time into schools and primary care medical practices, and that what we need to do is to build and test multi-component and multi-objective prevention infrastructure that works at a reasonable cost and can be easily adopted in these settings of primary care and school systems. And I think that that's going to be our most direct avenue to success. And I'm going to flesh out some of the details of that as I go along. But I'm going to start by contrasting these solutions to a lot of what I hear about in strategic conversations in this field. A lot of the suggestions these days are about how to frame what we're doing to make it more convincing. And I think I see people who are engaged in this conversation as emphasizing a number of different frames that they think would be helpful in trying to advance the field. So, a children's rights framework, to emphasizing that protecting kids from violence and assault is a right. This is a moral absolute. It's tied to the Convention on the Rights of Children that has been adopted internationally. And by emphasizing that, we'll get people to take this issue more seriously. There's the neurobiology framework, that child maltreatment causes damage to brain architecture that greatly impairs development and has lots of later life effects. If we convince people about the harm that it causes to the brain, we can really get people mobilized on this. There's the adverse childhood experiences framework, that child maltreatment is a form of toxic stress. It's connected to a lot of later life health problems, and if somehow we prevented those adversities, then we would be preventing all these later life health problems. And if you really realized and tallied up the cost of all those things, everybody would be convinced that this is a mission that we need to accomplish. There's an econometric impact approach that I think I see a lot of people taking, pointing out that there are all these costly downstream consequences. If we could tote them up, the effects on lost earnings, social services, criminal justice system, if we could recognize how easily we could recoup that money if we took care of this problem, that it would more than pay for the prevention, that we would be, that would seal the deal on the case. Now, I think that these points are valid, they're worth making, but I don't think that they're sufficient, and I don't think that they plot the path forward, because I don't think that they address what I see as some of the crucial obstacles to getting people mobilized on this issue, and that I don't think we have sufficiently confronted, and I'm going to talk about those. The key emphasis of a lot of these frameworks is that child abuse and neglect is wrong, it's bad, it's harmful, it's costly, and if we could clearly prove this and sufficiently publicize it, then key decision makers will join our cause and unlock the funding and the legislation and all the resources that we need. But I think it's more complicated. I'm of the opinion that now, after 50 years of advocating and agitating about this, that most professionals and policymakers and a very large segment of the public do by now know and accept that child abuse and neglect is common, that it's wrong, that it's harmful, and that it is the root of a lot of other social problems. I think those points have been made, and that we see people just in ordinary life using that as an explanation for bad things that they see is going on in society. But if they're not mobilized or rushing to spend money in passing legislation to solve the problem, I think it's because these policymakers, professionals, and public do not know of or are not confident about solutions to the problem that are effective, reasonably priced, and easily integrated into existing institutional systems. I think we've convinced people that it's widespread and serious, but we've not created confidence that something can be done about it readily with a reasonable expenditure of resources. And I don't think that perception is entirely mistaken. It exists in part because the ready solutions have not been fully developed, not been fully fleshed out, have not been adequately refined, and have not been adequately tested. So we don't have the convincing outcome studies and the demonstration programs that say, do these 3 things in your community and child maltreatment will be reduced by 30%, and it's just that easy. We sometimes like to think we have these solutions, and we certainly have a lot of promising ideas and programs and practices that are in the course of development. But I think if we're fully honest, we still have not replicated them, refined them, tailored them, and then integrated them into delivery systems. We're not terribly far from that goal, but we still have a ways to go. I describe making this transition from talking about how bad it is and how harmful it is and how widespread it is, to talking about the way in which we can successfully address it, as moving from the advocacy phase of a social problem mobilization to the efficacy phase. And I think this is what we're trying to do right now, is move into the efficacy phase. And I actually have this critique of the research in this area as well. I think too much of our research is still focused on showing that child abuse and neglect have bad outcomes, And I'm not sure that we need that many more studies on this. I think we need a lot more studies showing what works. That this particular set of parenting skills disseminated in that particular setting to this particular kind of parent, that it's readily taken in, adopted, and makes that family safer for children of a particular age. An example of what I'm thinking about is the program, The Period of Purple Crying, which is a program to prevent shaken baby, and it teaches parents how to deal with inconsolable crying children, and that's exactly the sort of thing I think we need. But honestly, even this program, which is one of the more developed and more disseminated, we're still have uncertainties about how effectively it works, what are the core components. We're still nailing down the evidence and figuring out how to integrate it and implement it. But that's just one piece, the shaken baby. These are examples of prevention skill sets that I think we need to impart. How do you get men not to lose patience with disobedient or resistant children? How do you get 13-year-old boys not to try sexual experiments on their 8-year-old sisters and cousins? How do you get depressed moms to recognize their problem and get help? How do you teach parents to make good judgments about when to leave their kids alone and who is actually a responsible caregiver and somebody that they can trust with their kids? I mean, we have general idea about some of this and programs to address some of them, but we haven't built this into a proven infrastructure that we know how to deliver to the appropriate targets and that we have confidence will work. So if policymakers and practitioners are somewhat reluctant to buy into our full-scale mobilization, I think it's because we haven't yet provided the detailed solution. Now, I think this obstacle of not having enough of the solution yet in place is compounded by another problem that also faces us when we try to mobilize. We're trying to market our ideas and solutions in what is a very competitive public policy environment. So we're currently competing with a lot of other child policy entrepreneurs who are very motivated, very persuasive, and are ahead of us on the trajectory of providing solutions, I think, in some ways. So I'm talking about advocates for early childhood development, preschool education, nutrition education, AIDS, smoking prevention, substance abuse, SIDS, all kinds of child issues, and general social policy issues as well. And what we're doing is we're going to shop our ideas about child abuse prevention to doctors, politicians, school principals, foundations. And we think our ideas are great, but from their point of view, they're contrasting our proposals against the proposals that have been pitched at them by many other compelling causes, some of whom have a better track record in terms of their success. More evidence for their programs, more history, dissemination, more scope to what they're doing. And so I think we need to really take this in competitive environment more into account in thinking about how to proceed. We have to do what some folks call a landscape analysis, and basically ask, what are other social problems that have advocates that are natural allies for ourselves? How could our goals and programs mesh? What is out there that's succeeding in the public policy environment in these allied fields, and how can we build on or tie in specifically to those other successes? The example that most inspires me is the success of what's called the home visitation programs and home visitation models. Home visitations as a program, as a policy, is experiencing some significant liftoff lately. The government's provided a large amount of funding to expand this program as part of the Obamacare legislation, and it is currently experiences quite a bit of favor in policy circles. But this is what's important. Home visitation from the outset was never pitched primarily as a child abuse and neglect prevention program. It was a program that was targeted at a wide swath of child and family objectives: accident prevention, immunization promotion, breastfeeding encouragement, contraception and family planning. There was a broad alliance of advocates who were behind that particular approach, and that alliance, I think, very much helps to explain the success that it had. So how can we replicate this? Well, where should we look? Where can we look for allies and synergies? I'm just speculating. This is not, an area that I spent a long time working on, but I at least want to get the discussion going on this. So, for example, family planning and contraception. This is an obvious area for an alliance. These programs are working with a lot of people who are soon going to become pregnant and soon going to be parents. And many of the people who go to programs like family planning come from segments of society where they may encounter problems of support around their parenting. The evidence for the efficacy of family planning and preventing child maltreatment is very clear, in the sense that one of the big risk factors for child maltreatment is family size. And I sometimes like to say that probably the most successful and biggest child maltreatment prevention program that the world has ever seen has been the dissemination of contraceptives and family planning, and the fact that the fertility rate in the world has come down just dramatically in the last 20 years or so almost certainly means the amount of child maltreatment has declined as well. So there's tremendous potential for synergies there. Preschool education, getting disadvantaged kids into educational programs is a very big priority among a lot of policymakers. It's demonstrated clear evidence for positive outcomes for the kids as they go through their education. Parent education is a natural component of this, and certainly builds on the goals of early childhood education. We do make alliances with them in places like Head Start, but obviously we need to, I think, develop those even more. Depression screening and treatment. There have been big advances and successes in the area of depression screening and treatment, because we now have some excellent evidence-based tools for dealing with that. Building out this capacity and adding content for parents with children, with people who are depressed, and handling their parent problems. That's an obvious place for more alliance. Alcohol and substance abuse. Again, these are very big risk factors for child maltreatment. There's a lot of public policy energy that's going into drugs because there's some crises in this area now. There was that picture of those two parents passed out with a kid in their car. What they got was removal of the child. Okay, but as part of drug treatment and drug abuse prevention programs, how can we graft and make child maltreatment, parenting kinds of things an integral part of that? Dating violence prevention is another area that's getting a lot of big boost because of outcome studies showing success. Obviously, some of the skills that are involved in preventing interpersonal violence at that level is very useful in terms of preventing violence in families and parenting. Bullying prevention. There's obviously very important ways of grafting sexual abuse prevention education together with bullying prevention programs. So in each one of these allied mobilizations, I think what we need to do is find out who the key players are, look at the key programs and strategies, and figure out exactly where the child abuse and neglect prevention component could fit in. And we need to build the argument and evidence for synergies across these various programs. But I think we need to do more than ally with these various other mobilizations. We need to ally with whole delivery systems. And this is something that maybe we've given inadequate attention to. It's not enough to have programs. It's not enough even to have collaborative programs. We need the delivery systems where these programs are actually provided to the target populations. And as you may have guessed from what I said at the outset, I think that we have to pay particular attention to the two most proven delivery systems, which are schools and physicians. And the way I see it, there are these 6 important and attractive features of these systems that suggest why we should look to them and prioritize them for our prevention activities. First of all, they are large and well established, and although they're pressed to do a lot of things, they do have a considerable number of resources at every level of government. Secondly, they are universal in their access. Virtually all children in our society spend time in schools and see physicians over the course of their development. So it provides a very good leverage point for access. It's international. These two institutions exist in most countries around the world. So as we do work in this area, the work will be generalizable, I think, to many other places. And in fact, I think these systems, the educational system and the child health provision system, are actually more similar across the world than other sorts of systems like child protection systems and mental health systems, which are variable. These two institutions are trusted and credible, more so than child protection or mental health, I think, or even police, to tell you the truth. They are seen as sources of help, and that the professionals in those institutions are people whose ideas and thoughts are greatly respected. And these institutions are also open to empirical science. Once again, more than some of the other institutions we work with. I'd say frankly, and I don't think this is, hope I'm not hurting people's feelings, but I think schools and healthcare is more amenable to empirical science than is like the child protection system, and certainly more than the criminal justice system. Both of those institutions have a long history of doing evaluation studies of the programs that they implement and making decisions based on the success of those outcome studies. And that, from my point of view as a scientist and an evaluator in this area, is very important, that the likelihood of being able to get programs adopted based on their scientific success, I think, is going to be greater. And finally, I think both of these institutions operate programs that already contain components of what we want that have proven to be successful. So in the case of health practices, they already provide guidance to families and parents about things like seatbelt usage or car seats, and have tested successful programs to do those kinds of things. And schools are already providing programs like around bullying that have been proven to be successful, that are very similar to the kinds of things that we may want to do around child maltreatment prevention. So I think we need to design more of our programming and do more of our research with these two specific systems in mind, and start interfacing with them more regularly. Now, here are some specific things that I think we do have to do to kind of operationalize what I'm saying. So we have to build the programs that fit into the operations of these two institutions. I don't think we often do that. I think we're thinking about having kind of freestanding programs. I think we have to respect the time and resource constraints that these two institutions, they're trying to do a lot of things, so we have to be constantly aware of the fact that whenever we ask them to do something, it's likely to be a burden. We have to coordinate with the other advocates, as I said before. I'll get more into that. But I think what that means is having whole curricula or whole, kind of envisioning the child, a package of assessments or procedures that can be implemented by somebody who is part of a practice. I think we need to adopt a developmental approach, recognizing that both of these institutions deal with children across a wide age span. I think we need to modularize the tools to make them compatible with different approaches. And that's just recognize the fact that, schools differ, practices, medical practices differ, so there need to be ways in which modules can be taken and adapted to the different environments that these institutions have. And finally, I think we need to influence graduate training. Both of these institutions have very large, important systems that prepare people to be part of those institutions. And I think in both cases, we haven't really sufficiently insinuated ourselves into the graduate training programs of these institutions to make sure that our ideas and concepts and programs are that they're exposed to them at an early stage when they're themselves, baby professionals and are more open to influence. So let me talk about some of the specifics with regard to pediatrics. I think pediatricians and also the primary care family physicians who work with children as well are increasingly open to the idea that they need to address child maltreatment. So, for example, here is a report by the American Academy of Pediatrics that took a very strong position on the importance of dealing with these issues. And in many places, they're experimenting with models of having a social worker or family life educator or behavioral health specialist integrated into their practice who can deal with this kind of issue along with other family problems. And what we need to do is think about giving these practices the concepts and tools to do this. And I think we have to go both large and small in this. I think we need to have big concepts and big ideas as well as small, very useful and practical things. So let me give some examples. I skipped a slide that I wanted to, well, maybe I didn't. All right, I'm going to go through that in just a second. On the small end, I'd say we need things like handouts, videos, modules, web applications that all have proven effectiveness to reduce various forms of child maltreatment and their precursors. So, the brochure on how to deal with sibling conflict, how to handle oppositional behavior, how to protect against sexual abuse. There's plenty of evidence that these kinds of things work to prevent child maltreatment, these parent education kinds of stuff. But honing it down to its most efficient, most elemental components, I think that's what needs to be done. But then on the large end, we need to build these comprehensive programs that deal with multiple child health and development and make sure that the crucial effective child maltreatment prevention elements are included in that content. And maybe the best example of moving in that direction is a program that our colleague Howard Dubowitz has developed at the University of Maryland in Baltimore called Safe Environment for Every Kid. It's an office-based program. It's tailored for use by a family life specialist or by the pediatrician in the office. It's a multiple component program, so it deals with maternal depression, substance abuse, domestic violence, food insecurity, along with harsh parenting. It has handouts. It's working to incorporate some more digital components. It's been evaluated now in 2 clinical trials, and it's been shown to reduce child maltreatment and some other negative child outcomes. So that's the kind of bigger, more comprehensive program that I think we could be working on. But I think we can't just rely on SEEK. One of the things is that there are numerous multi-component comprehensive parenting programs out there already, like Triple P Parenting or the Incredible Years. They're all already widely in use. They're well known. They're likely to be incorporated into any office-based programming and referral systems. And we have to make sure that the content included in these programs is as comprehensive and effective as possible in addressing the child abuse and neglect elements. So for example, maybe some of you know this, but it's not clear to me how much effective content these programs contain about the problem of sexual abuse. My sense is that's not an issue that has been incorporated into those more widely disseminated parenting education programs. But these programs are integrating themselves like crazy into pediatric practices all over the place. So I think the question that we have to ask is, does it make sense to design and promote separate sexual abuse prevention programs or physical abuse prevention programs that we're targeting to these practices, or maybe climb aboard the bandwagon and work to get these elements like sexual abuse content into these better disseminated programs rather than to try and start from scratch and develop something new. I also think we need modules for training the practitioners to go along with the programs or as a standalone. We also have to develop assessment instruments for the kids and families who need these programs and can monitor the outcomes to see when improvements do and do not occur. I do want to, sorry, I thought I had something comment. I do want to make a comment here about the screening issues, because there's been a lot of interest recently in screening for ACEs in various kinds of venues, pediatric practices or schools or early childhood education environments. And I have to say that I'm a little bit, or maybe a lot, concerned about this particular excited idea. I do think that ACEs is a very important and useful concept for educating people about the impact that child maltreatment can have. But the idea that people have is because these adversities are so important, we ought to be screening for them. But unfortunately, if you look at the public health literature on screening, it's much less reassuring than it might seem. There have been a lot of examples where people come to see something as being a precursor to other bad outcomes and decide that everybody should be screened for it, like, screening people for, spots on their lungs, or having all men screened for a high PSA value as a precursor to prostate cancer. But these screening regimes have, in many cases, created a lot of activity and intervention that didn't necessarily improve outcomes, and even created a lot of unintended negative consequences and unnecessary interventions. And I'd say that the best advice that comes out of the screening literature, and I was talking with Shanta Dubey about here earlier, is that you should screen for conditions and problems for which a proven intervention exists. So screening for ACEs just to see what children are at risk may not necessarily be helpful. If there is an availability for example, treating traumatic stress symptoms, or then that's something we should screen for. And we don't necessarily have good programs that treat children simply for having a history of sexual or physical abuse. We have we have programs for treating families that are currently engaged in that behavior, or, for example, or have other dysfunctional parenting patterns. But I think those are more what we should be screening for than historical things. I also want to highlight the fact, and this is something that's been very disappointing to a lot of people. There's been a lot of effort to screen in recent years for domestic violence, with the notion that we understand this to be a very destructive and harmful kind of family condition. But the evaluations that have been done on screening for domestic violence have not shown that it improves the outcomes for the women who've been screened for it. We don't know exactly why, but one of the good reasons could be because we don't really have proven effective treatment regimes, and that certainly what we have has not been disseminated in all the places it needs to be for domestic violence. All right, so that's just a little digression. I want to talk a little bit about schools and not impose too much more on your time. But I think schools are a particularly important delivery system, as I said, because they're universal, respected, cover a wide swath of childhood, and have a tremendous amount of evidence that school-based prevention programs are effective. There's been some impressive meta-analyses of school-based programs to deal with all kinds of socio-emotional, behavioral, educational, and life problems, which show quite consistently that these programs are successful, and that the ones specifically targeted at reducing abuse and violence have that same record of success, decreasing bullying and victimization when they're used. And so that's a very encouraging finding. There's also evidence this is an interesting study too that shows that school-based education can be effective at changing the quality of parenting 25 years later. So that some of that education that kids are getting in school actually has a substantial amount of durability to it. The other thing that I think recommends schools strongly for contributions to this area is that the research all suggests that educators and schools are the place where most child maltreatment gets recognized. Not necessarily where most of the reports come from, it's not necessarily where most of the intervention occurs, but in terms of knowing what's going on and being able at least to respond to it, schools and teachers are the place with the greatest level of awareness. So, having said that, what's remarkable to me is how little interfacing there is between child maltreatment professionals and educators. How many people here, just as an example, are working in a school environment? I'm kind of curious. So there's a handful. I'm great to see you there, but on the whole, when I go to child maltreatment meetings and education forums and so forth, the percentage who are coming from schools always seems to me to be relatively anemic. They don't regularly come to our meetings. We don't go to their meetings. They don't publish in our journals. We don't publish in their journals. And so I think a big priority is to ramp up our game when it comes to alliance and outreach to the education profession, and particularly the professional organizations in that field and to their graduate training programs. And I think we need to try to find ways to include more in their training with modules that fit into their education courses. And compared to healthcare, unfortunately, I think that's maybe even a greater challenge, because the education profession compared to the healthcare profession, I think, is more decentralized, regional, and fragmented. But there are some important things to notice about the educational environment. Time and attention, of course, are very scarce resources in schools. They're under pressure to produce a lot of various kinds of outcomes. There's also tremendous competition within schools among different prevention priorities, health behaviors, sexual education, not to mention increasing academic performance and so forth. So I think we have to look at what allied efforts have the most access to schools these days. And my sense is that some of the most successful current mobilizations are around issues related to health, like nutrition and smoking, substance abuse, bullying, dating violence, early childhood education, and perhaps something, the area of socio-emotional learning. And I think we should look carefully at the content being purveyed in all of these programs and see where some of our child maltreatment prevention content would best fit in, enter in discussion with these programs, and develop and evaluate the components that can be incorporated or coordinated with them to increase our leverage on the things that we want to see improve. I also think that we need to bond together to try and develop the most comprehensive approach possible. Ultimately, my vision is, and I think hopefully this is where we'll end up, is that there will be a comprehensive and developmental curriculum that's built right into the school program about social and interpersonal skills and family support, and that this will be an integral part of the curriculum like language arts or physical science. And it will help if it also builds this kind of a comprehensive program, academic skills in the various substantive areas like science, numeracy, and language arts. And I think that's all possible to have a kind of socio-emotional program that also contributes to the improvement of students' numeracy, science, and language arts. But that obviously is a big task that we're not going to do on our own, but I think we should be trying to envision how that looks and building alliances with people who can help make that happen. There is some initiative in our field that is moving in that direction. The one place that I'd like to highlight is the second step, or the programs that are being developed at the Committee for Children out in Seattle. They're kind of working and thinking about the educational environment in a big way and how to incorporate child abuse prevention skills, as well as helping to work on some of the other prevention topics. Another program that does something similar is the 4th R program, came out of Canada, tries to reduce exposure to violence, delinquency, but also addresses substance abuse, sexual behavior, relationship decision-making. It's targeted at teenagers. So, all right, so just to conclude, this guy's talking too long, I think. I've got a surprise for you at the end, though. I'd like to see I'm urging that our field focus on a strategic vision that emphasizes these two avenues, these two leveraging platforms, medical practices and public educational institutions, preschools, elementary schools, high schools. And the strategy should involve strengthening and deepening our field's connection to these institutions. In partnership with the practitioners, we need to develop the most efficient prevention components that can be integrated into these settings. And that we need to collaborate and not compete with the other prevention mobilizations that are out there. Now, I hope this doesn't sound too discouraging for you. I'm not saying, and I don't want this to be interpreted as saying, that in order to succeed, we need to build this whole infrastructure and set of alliances to test it out, and this could take 20 or 25 years, and how many of us are going to be around that long? So it is a slog, and it's not going to happen tomorrow, but I mean, it's not as though everything is on hold until that happens. And I just want to remind people, I think this is something that we have been making some tremendous progress, that, even with the relatively crude tools and scattershot approaches that I think we've been taking, it does appear as though various kinds of child maltreatment have been declining. Here is the data from the National Child Abuse and Neglect Data System, which shows big declines occurring in substantiated physical and sexual abuse. Here's data from hospitals, showing that abusive head trauma has declined. And it's not just cases that are coming to the attention of professionals, it's cases that we hear about by surveying potential victims. So here we see in surveys of young people about their own experiences with violence and assault, that they report dramatic declines in the number of assaults that they've been experiencing. There are a variety of many other sources of information that show similar. I'll skip that one. This is a survey, for example, from all 6th, 9th, and 12th graders in Minnesota showing declines, physical abuse, also sexual abuse. I didn't put that slide up here, and declines in intimate partner violence. So I think our strategies and our science should be about accelerating the pace and extending the improvements that we've been seeing. I like to remind people about the history of tuberculosis, which was a major scourge of the 19th century, 18th century, one of the main killers. And it turned out that general public health measures and knowledge about transmission and improved economic conditions made a big difference around the turn of the beginning of the 20th century. Sanatoriums, x-rays all helped. But we were still looking for the cure, and then antibiotics came along and were proven successful, and then the rate of TB really fell even further. So I think we're on the right track in our approach to child maltreatment. We have the concepts and tools. The tide is moving in our favor. We just need to coordinate our efforts and make some strategic choices to be sure that it happens sooner rather than later and spare more generations the scourge of child maltreatment. Now, I realized that this event was partly to honor the departure of our dear colleague, Mark Chaffin, but just recently we lost another luminary in this field as well, who I also just wanted to take a moment to honor, Murray Strauss, who has been involved in this field from nearly its beginning. He's often been described as the father of family violence research, and he certainly did, I think, more than any other individual to lay the foundation for this field in empirical science. He developed the conflict tactics scale, which has been crucial in measuring this problem, has incorporated many elements of it into the ACEs scale. He established that children and adults were much more vulnerable to assault and abuse within their own families than they were at the hands of strangers, which I think has revolutionized our whole view of crime and in society. And then he took on the problem of corporal punishment and wrote a book about it and assembled much of the research showing the negative effects of corporal punishment. And like Mark, he was one of those just wonderful people who made everybody feel smarter and being around him. I have an unusual way of honoring people, which is I like to write a song to honor them. So I'm going to sing the song that I wrote about Murray Strauss as to finish up here, because it's about our field as well, and sort of has a way of remembering some of the contributions he made. Once there just was silence about all family violence. The textbooks, they were mum. You could search every journal and you'd never find a kernel or a tidbit or a crumb. But then there came a scholar, unfazed by family squalor, and look how far we've come. We've got books, websites, Oprah, even courses that we hope are in the core curriculum. He said, where there is lovin', there's hittin' and there's shovin', and crime upon the sheets. 'Cause the bedroom you nap in has more punchin' and slappin' than the bar rooms or the streets. He showed how DV can explain all kinds of wars. It's the universal everyone ignores. It's all right there behind closed doors. Well, the experts were dismissive. You cannot research this if folks must their crimes confess. He said no, there'll be candid family violence is so standard, thus was born the CTS. He said when folks are hittin', they usually think they're sittin' on the side of righteousness. They say, oh, I was sad to, but I really, really had to. That is why they'll tell you yes. Please check one of these. I kicked, I hit, I bit, I spit, I swore. Was that once or twice or thrice or even more? Thanks very much. And there's the score. So he and all his buddies went off and did their studies, and papers filled the room with a zillion calculations of a million correlations about who did what to whom. It so improved our science and helped protect our clients from rape and homicide. All the findings and theories and the questions and the queries that his wisdom did provide. So then he turned his attention to one more dark dimension of parents whacking kids, asking why kid assaultin' was so widely exaltin' and not something law forbids. He showed it was oppressive and makes kid more aggressive and apt to turn out bad. And though parents won't try to, it can lower kids' IQ and prompt them to hate their dad. Folks think it is the savior for children's misbehavior to get them to abide. But that smacking and whacking reinforces the backing that a hit is justified. He said, don't you see that a hit is still a hit, even when you say it's for their benefit? It scares and hurts, so let's just quit. He gave us the ammunition to ban corporal punition. It's coming true, that dream. And when we get rid of spankin', it is him we'll be thankin' as the leader of our team. So Murray has departed, but not these things he started. They're holding up real strong. Though we all mourn his leaving, he has left us believing that we all could get along. It's safer now for mothers, for fathers, sisters, brothers. He's harmonized the house. And for a world much less hateful, we can all be so grateful for the life of Murray Strauss. For a world much more peaceful and a lot less policeful, thank the life of Murray Strauss. Thank you.